sense that I'm a doctor who is also a psychiatrist, who is also a psychotherapist, and I suppose I feel as though we have a responsibility, to manifest as many of those different bits as much of the time as possible.
So I think medical psychotherapy does mean that I'm a doctor and a psychiatrist and a psychotherapist and a psychoanalyst. And I bring all of those different skills when I'm doing my job.
I come from a slightly different standpoint, having used psychotherapy services and medical seen medical psychotherapists. And I suppose, on a very broad scale, it means a kind of a treatment, but a communication and a dialogue, a duologue with, about, I suppose, your life, about your experiences. I suppose with the medical psychotherapy role specifically, it's a slightly broader role, so it's encompassing the fact that I am my kind of chemicals in my brain, and I am my early attachments and my experiences with relationships and other people as well. And if there are any issues or problems, I think that they get explored or they get looked at, and it's looking at my life as a whole rather than being with lots of medical systems, hospital departments. You'll go in and they will fix your broken leg, but they don't do anything else. Whereas I think with medical psychotherapy, they very much treat you sort of as a whole person, and looking at the kind of complexities that aspects of your life might bring up, or the complexities of even treatment on the aspects of your life.
I'm just trying to think back to when I was a medical student and what I was looking for. And I suppose I felt frustrated because I had an enormous curiosity about people, about their experience of illness, about culture, and about neuroscience. And at that point there didn't seem to be any avenue open to me which would allow me to explore those interests together, until I did my psychiatry placement. I came across a psychoanalyst, and at that point it was like a light bulb moment. That brings all of those things together.
I think of it as we're ultra high intensity, low throughput specialty, kind of like what I imagine neurosurgery is like, or complex cardiac surgery. When they do an operation, they might see 2 patients in the morning. They haven't got big throughput like GPs do, and I kind of think medically we're a bit like that. Some of this can't be done really quickly on lots of people, because we're dealing with deep developmental traumas and deficits and a huge amounts of pain.
So for me, I think being a medical psychotherapist, apart from being a doctor and a psychiatrist, is about committing to not seeing things in a single kind of singular way, and that knowing that there's always kind of multiple ways and multiple levels of people's experiences and inner experiences. And I think what it's given me in my training and what I'm trying to apply now in my work is how to work with uncertainty and not knowing, because that's so much part of our work. And I think being a medical psychotherapist really equips me to do that.
I think that medical training can often make you sort of feel like you've got to know. And if you're not knowing, then you're not doing your job properly. And how you manage those different cultural sort of experiences then of being in very different places and yet having to talk about things across those kinds of boundaries.
I've got an interest in somatisation now, and some of my work in that area is managing that inside-outside boundary, but also managing that between physical care and mental health care, and with the patient, between the sense of their mind and their body. And sometimes it feels like that's the work, is doing what you're describing. It's tough, but it's really rewarding as well.
Because I work in a service for people diagnosed with personality disorder who have kind of long-standing emotional, interpersonal difficulties, that holding on to both the developmental and also being able to manage in the face of very difficult or powerful emotions is so key. And that's kind of the bread and butter of what I see my job to be.
A lot of my work is in medical education at the moment. Medical psychotherapy represents a thinking space and a place to be allowed to be more reflective and allowed to take time to think about complex clinical issues and the doctor-patient relationship.
So I do think there's a role for psychotherapy, medical psychotherapy, with the NHS to build compassion, empathy and resilience as well.
Yes. Yeah, I think perhaps there's a certain sort of robustness, which might be different to the robustness that an A&E consultant needs, or a neurologist needs, or a forensic psychiatrist needs. But it's something to do with the enough openness to what you're going to experience from the patient, to be able to try and make sense of that and then make use of it therapeutically, without being blown away by it or just blocking it out.
Quite often having to sort of speak up for the developmental history, the childhood experiences, all the things that have happened to a person, when there's sometimes a lot of anxiety about managing risk, or medication, or the presentation that's happened in an acute way that's worried people. And sometimes I think the pressures on the teams and the anxieties, the immediacy and urgency of things can make it hard to sort of hold in mind the importance of a developmental perspective, really, and understanding the whole person, as you're saying.
So something then, it seems, about the inside, or thinking about the inside of the relationships, of what's going on inside somebody. And I suppose that would link in also with the sense of holding the whole history together from the start to wherever you meet somebody, and seeing that as a story. And I suppose I was thinking about it as everybody's story, where someone starts off, tell me about your life, and then actually seeing where in their life that corresponds to the difficulties they encounter, and when they've been admitted to hospital, when they've started self-harming or hurting themselves in some way. So some sort of linking very much with what's going on for them at that time in the whole environment.
In somebody who's very distressed, very ill, there is that fragmentation, and if it's just reflected back by the fragmentation of services, of different sort of modalities or different ways of thinking, just purely the biological, I'm just going to treat you with a pill, or I'm just going to treat you with, X, Y, or Z talking therapy, I think sometimes can be quite difficult for a patient when they're fragmented themselves. They find it very difficult to be cohesive if the things around them are are not cohesive.
There being so many different boundaries between, perceived boundaries perhaps between psychiatry, psychotherapy, psychiatry, medicine, or the rest of medicine, physical health care, mental health care. And I suppose, what you said made me think that actually things can easily get lost in translation across those boundaries, and that it's thinking of a way to convey what we've learned through our training, and to colleagues who've been through a different training in managing complex cases and advocating for patients in terms of their psychological well-being.
I think what you're saying is really important for all doctors, isn't it? It's not just, and I sometimes think it's not just in medical psychotherapy at all, it's important for all doctors, but sometimes our role can help enhance that. I suppose one of the things about medical psychotherapy is that by definition you've had your own therapeutic experience, and it's absolutely in you, the importance of development and life experiences and how you then react to things that happen to you in your life. So I sometimes think we have a capacity sometimes to help colleagues develop and maintain those aspects of their own work.
You're able to see it from the other side. So I think it's that experience of understanding sort of the chair the patient is sitting in, so to speak, having been there and having that empathy or sympathy with where they are in that kind of experience. I definitely think that should be sort of a shared perspective amongst anybody in medicine, really, because we are all patients as well.
We are patients.
We all go to our GPs, even if for a cold or for whatever.
We're all mortal and morbid and human.
Exactly.